have Sandy Penney come up right now, who's the Chief Operating Officer and VP of the Labrador Grenfell Zone of the Newfoundland Health Service, to give us a presentation. Welcome, Sandy.
Thank you, Ed. It's a hard act to follow after that announcement, but I'll give it a go. I should also mention, I know a lot of people in the room, but Lab West is my home too, like Ed and Belinda. So I wanted to take a minute to say that. Lab West has been my home for 31 years. So I'll go ahead and get started. My intention for the presentation today is to talk about Newfoundland and Labrador Health Services. As many of you in the room know, Newfoundland and Labrador Health Services is still relatively new in our province. We're as of 11 months old, the end of February. I'll spend some time talking about our vision, mission, and values. I'll put it in context of what's happening here in Labrador West and thoughts on how we move forward. So the creation of one provincial health authority was announced by the provincial government in budget 2022, following recommendations from Health Accord NL. And I might like to mention that we are so fortunate to be joined by Dr. Pat Parfrey, who will speak after me, as Pat was one of the co-chairs of Health Accord NL. On April 1, 2023, 4 regional health authorities, and you'll still hear people calling us regional health authorities, Eastern Health, Central Health, Western Health, Labrador Grenfell Health, and the Newfoundland and Labrador Centre for Health Information became Newfoundland and Labrador Health Services. The legacy organizations are now known as Eastern Urban Zone, Eastern Rural Zone, Central Zone, Western Zone, and Labrador Grenfell Zone, and Digital Services. The transition to a single unified provincial health authority was undertaken to streamline provincial programs and services, become more efficient and effective in the delivery of healthcare across this wonderful province of ours, with the goal of improving access for all residents in the province. Newfoundland and Labrador Health Services is responsible for the delivery of services to 510,550 Newfoundlanders and Labradorians, 22,500 employees, approximately 1,050 physicians, and over 2,700 volunteers. The organization provides a broad range of programs and services throughout a large suite of facilities, clinics, community services overseen by 5 zones. I have to say it's really difficult being in front of you today not to highlight our zone. So Labrador Grenfell Zone has 14 community clinics in very rural, remote parts of our region, 3 health centers and 3 hospitals and 2 long-term care facilities. But specific to Lab West, it's the Lab West Health Center. In terms of our, there they're supposed to change. Can you, I thought he was changing the slides. He must think I am. Okay. Again, please. And again. So a couple of presenters before me have talked about Labrador Grenfell Zone. We often refer to it as the big land. Make no wonder, when you look at us on a map, we cover the largest geographic space in our province with a population of 37,500. We cover all communities north of Bartlett's Harbour on the Northern Peninsula, and of course, all of Labrador. In terms of our lines of business, click, thank you. So in terms of our lines of business, we're responsible for promoting health and well-being, providing supportive care and rehabilitative services, treating illness and injury, advancing knowledge and transforming health systems. So when you think about promoting health and well-being, which I know Pat will follow me and he will talk a lot about well-being in our province, it concludes population health, surveillance and epidemiology, growth and development in the early years, health promotion, health protection, and disease and injury prevention. Providing supportive care and rehabilitative services. When we look at this line of business, it's individual, family, and community supportive services, long-term care and residential services. Treating illness and injury. In this line of business, we're talking about primary health care, ambulatory care, emerge care, which we hear a lot about in Labrador West, mental health and addiction, surgical services, and tertiary hospitals. The last line of business, the categories include education, research, innovation, planning and performance, data and information services, and digital health services. The vision of Newfoundland Labrador Health Service is health and well-being, every person, every community. And many presenters before me, we've talked about, we have to work collaboratively, and our vision speaks to that. We're not in healthcare on our own. We always must work with, and we do, with our residents, communities, and partners to achieve this vision. It's impossible to achieve without our partners. Our mission, working together to improve health outcomes through an innovative, integrated, and sustainable health system. Our values, innovation, compassion, accountability, respect, and excellence. I really like when we worked on developing our values, when we became one, I really like that we came up with a very easy to remember acronym, I CARE. It helps me. Okay, let's shift gears a little bit now and talk about current context in Labrador West. I'll provide an update on where we are at with our current staffing situation at Lab West Health Centre, how we quite regularly manage to mitigate many issues in our community. I'm also very pleased to provide an update on being made around family care teams in Labrador West to date. Medical transportation has been a hot topic of concern in our communities across the zone and here in Labrador West, and we are pleased to see some movement throughout 2023 on this issue. So in terms of human resources, I mean, we are no different than any other part of the country right now. We're experiencing major challenges with recruitment. It's no big secret. Accommodations are often an issue in Labrador West, as Belinda Adams spoke to earlier. Struggling with, obviously, recruitment and retention issues. We have incentives in place for both physicians and our nursing vacancies. We have just recently filled 6 full-time positions, nurses, that will work on the inpatient unit at the Lab West Health Centre. And I think the really good news I want to share with you, as most of you may or may not be aware, we have 8 physicians in Labrador West if we were fully staffed. We have 4 of those positions filled. The 5th one is coming back to us in March. And of those 4, we just had a recent brand new doctor join us. So 5 are filled as of March. And as a result of practice readiness assessment program that physicians go through, we will have 7 out of 8 of our positions filled as of July this summer. And in terms of incentives, I mean, there's quite the list of incentives that our government are offering to physicians to come to Labrador West. But as we all know, it's about them coming to Labrador West, and then it's about our community in terms of keeping them in Labrador West. Just like myself, as a very young grad, I came here, didn't know much about Labrador, and I'm here 31 years now, and I would never have changed it. I'm sure I heard Premier Fury mention some others in terms of family care teams. So what are family care teams? Again, I go back to Dr. Pat Parfrey. So the vision for family care teams was inspired by Health Accord NL, and it is to give every person in our province timely access to health care and to continuous patient-centered care in the community as a part of a well-connected team. Thus far in Labrador West, as a result of working very closely with Matt Sullivan, who I have the pleasure of sitting next to today, we are co-locating our family care team in Labrador West with Physio North. The establishment of family care teams within this zone, so we can access primary health care services, includes, but not limited to, family physicians, nurse practitioners, registered nurses, and other healthcare providers, social workers, physiotherapists, occupational therapists, to deliver a team-based approach to care. Because we all know providing care is not just about the physician, right? It's about those other providers that patients need, not just the physician. So I'm happy to say our current status for the Labrador West Family Care Team is we have our collaborative practice manager has hired and started. Just yesterday, we filled one of our registered nurse positions has been accepted, and we're still ongoing recruitment for a licensed practical nurse, OT, physio, rehab assistant, and clerk 3. So we're still fairly early stages, but we are making movement. As well, in terms of medical transportation, another hot topic across our zone. In January 2023, Heart Force One was established to give cardiac patients timely access to cardiac procedures. Since January 2023, we've had 22 patients from our zone be brought to St. John's by Heart Force One, 4 from Labrador West. But it's very important for me to note that not all patients qualify to go on Heart Force One, to go to cath lab to have the procedure. They have to meet very specific criteria. So most patients, all patients that go on Heart Force One have to be totally stable. Those other patients go medevac or normal medevac route. On September 8, 2023, I had the privilege of being joined by Premier Andrew Fury and Minister Lisa Dempster in the cafeteria at the Labrador West Health Centre, where they announced a voucher program as an expansion to the existing medical transportation assistance program, which now covers $1,000 of eligible airfare to larger centres. And last but not least, in December 2023, as others too have mentioned, Newfoundland Labrador Services announced a move towards an integrated air and road ambulance service for the whole province. At this point, when I was preparing for this presentation, I reflected, I thought, so we've been one now 11 months, so what has been the benefit? And that's what I stand before you today, and I'm so proud to say that I am a part of this new leadership team. And some of the benefits from transitioning from single RHAs where we worked in silos and isolation. You didn't have the privilege to work with a full provincial team that you could drop on. So obviously it's the team approach versus 5 separate health authorities. Provincial initiatives, which I've already mentioned, Heart Force One and the family care teams. And what I see is, like I say, I can remember when I was in the position of in my earlier days, and I reached out to our CEO, David Diamond, when we had some issues with Lab West Health Centre and our ER, our physician coverage in ER. And Dave's words were to me, Sandy, it's no longer your problem, it's our problem. And we quickly pulled together the team, and within minutes, we had physicians come from other parts of our province to come up here to assist in our category AER facility. So to me, the benefit is the collaboration, and you no longer feel like you're in this alone. So in terms of moving forward together, I mean, many of you have already said it. I wrote down Ed's quote as he started, if I could find it. It's about, we can't tackle these problems alone. We all have to work together, and we all have to come together as various departments and communities. And in terms of our partners with Newfoundland Labrador Health Services, we work collaboratively with a broad range of partners, Indigenous organizations and government. I moved that up as bullet 1 on that slide because it's very near and dear to my heart in this zone where we have a population of 35% of our individuals are Indigenous. And I work, besides what I do here in Lab West, very closely with our partners throughout the zone, academic institutions, communities, federal, provincial, and municipal governments. And of course, we can't forget our local businesses. So I had the honor of joining Mike and his team, Marcia, Amy, at the IOC breakfast not long ago. And we are starting to, we're working towards, just to give you an example in terms of our partners with business, we're in the process of working with IOC to secure a house for physicians, which will help with recruitment and retention for us. So that's what it's about, right? The motto goes, it takes a community to raise a child, well, it takes a community to solve our healthcare issues. So on that note, I'm going to stop. No, I have one more. So in terms of moving forward together, it's about continuing to keep partners informed with transparent, factual information, working together to find solutions to positively influence social determinants of health while addressing current regional challenges. and most importantly, transparency and keeping lines of communication open. So on that note, I have the privilege of introducing Dr. Pat Parfrey. So Dr. Pat Parfrey is the Deputy Minister of Health Transformation with the Government of Newfoundland and Labrador. Having co-chaired, like I mentioned, Health Accord NL, Pat's new role as Deputy Minister is to work across government departments to engage in the implementation of the Health Accord to improve the health outcomes within our province. Pat is a clinical epidemiologist and John Lewis Patton Distinguished University Professor at Memorial University of Newfoundland and Labrador, and has an international reputation for patient-related research in kidney disease and in genetic disease. He is an officer of the Order of Canada, member of the Order of Newfoundland and Labrador, fellow of the Royal Society of Canada, and fellow of the Canadian Academy of Health Services. In Pat's extracurricular time, which he probably don't have much of, he enjoys coaching and managing rugby in the province and in Canada. Thank you.
So the Premier did steal my thunder. But Sister Elizabeth used to always say, if it's an important message, you got to say it 3 times. I'm in a kind of an invidious position, really, because deputy ministers are not really meant to be in the public arena. But I was hired kind of, I suppose, to represent the public and trying to influence how the calls to action of the Health Accord were implemented. So I do speak in the public arena about that, and that's what I was asked to speak about. I want my remarks to be, which are about well-being, to be for you to think about them and apply them to your 10,000 people that are living in Labrador West, and how the messages that I'm putting across are going to be applicable to your community. And in the next slide, I think that this is the kind of summary of what the Health Accord tried to say. It said that we need to be aware and intervene in the social determinants of health, and I'll speak about that to a fairly large extent, and develop a quality health system across the acute care side, the community side, and long-term care, and that we needed to build those the bridge that's necessary for change: a health information system, an ambulance system, money from the federal government, a governance system, workplace relations, etc. So I'm only going to concentrate on the pillar concerning the social determinants of health. In other words, those social factors that influence our health outcomes. And in the next slide, this is what the Premier said to his Minister of Health in 2021. I asked that you work towards making our province one of the healthiest in Canada by 2031. That's not going to happen without action on the social determinants of health. So in the next slide, and this is the reason I'm saying this, is we know that what makes us sick, what affects our health outcomes, are these factors that influence our lives: our income, early childhood development, education, social exclusion, employment, working conditions, Aboriginal status, homelessness, community belonging. We know that's 50%. And then you can add another 10% concerning our environment. So 60% of our health outcomes are influenced far more than the healthcare system, which only influences 25%. But from the public discourse, you wouldn't think that was true, because we are constantly talking about that we need more providers for this and that. Whereas in fact, if we invested in improving our well-being and the social factors that influence our health, we'll get better health outcomes. And I'll show you in the next slide the implications of us not being aware of it and not choosing to push forward in influencing the social determinants of health and in healthier living by our spending. So here's the spending in Canada, or in Newfoundland, for social spending over the last 40 years, flat as a pancake. Here's our spending on healthcare. All right, I'll shout when I go over there. gone up by 232%. In Canada, it's gone up by 100%, and our spending on the social side is 32%. So we're voting with our feet. We believe that healthcare is the most important thing for us. And I'm trying to get across to you that it's not. The most important thing for us is to influence those things that lead to bad outcomes. So the next slide, and I'd like you to think about this now from your own particular situation, about what efforts that you could put into your community that's going to improve the health outcomes of your community. So let's face the facts about poverty in the economy. No, you're the wealthiest community in the province. However, poverty equals ill health. It's very expensive because of the adverse consequences of poverty. We have big public funding on consequences and not causes. And if anything, childhood poverty is unjust. Its economic and financial costs last a lifetime. And we know that the most influential money you can spend on intervening to improve health outcomes is to improve childhood poverty. That's well known. And finally, economic development is connected to a healthy society. So those numbers that we're talking about bringing in, improving the economy, should also lead to an improvement in health outcomes. So the next slide. So what are these social factors that influence health? Life with economic security, sure, for absolutely. A livable basic income, food and housing security, and income support. Where we live, we just heard an announcement about the climate emergency. That's good to hear. That is probably the single biggest thing that's going to influence over the next number of years. And we need to have not only awareness of it, but we need to reduce our footprint. The piece that we neglect, and we heard this time and time again from in the health accord, engaging with various groups, that they feel excluded. Now you might say, sure, we're a really friendly community, but the people with disabilities, Indigenous people, the LGBT community, immigrants, people of color, all felt excluded. And that influences their health. Their health outcomes, if they're excluded, are worse than those people who are included. And then the other final one that we feel is really important is investing in our future early childhood and youth. That's people between 15 and 30. And I'll come back to that in a small while. The next slide. So I won't read this out. I would just say to you that the reason that we want to try and get people to think about well-being is important, and well-being is this social factors that influence health and healthy living, is that you know this for a fact, our well-being is more than our physical health. It's our mental health, our social health, our financial health, our environmental health. But we're bringing it all down to our blood pressure and our weight and the kind of the physical components of our well-being. The second nuance is well-being is not only about healthcare, it's about social care and education and environmental responsibility, etc. And and what is the third thing? I'll come back to the third thing when I remember it. Oh yes, I know it is. I just saw it, but it was right there. So people then think about well-being and the social factors that influence health, and they say that's government's responsibility. That's up to the government to spend the money on these programs. I disagree. I think it's everyone's responsibility. There's a family living in a community in which they live, and that community and that family can do things that will increase their well-being. So we've got to think in a much broader way about how we improve well-being. And that's why I'm saying to you, with your community of 10,000 people, that you can do things that can influence the well-being of your inhabitants, that will not only we know it will increase their life expectancy, but it'll also increase the quality of their lives. The next slide then, please. So just let's play this animation, this is provided now to explain to you what we believe well-being to be. We need the volume. Well, sorry about that. No, we got no volume. So anyway, it includes where and how we live and work, and what supports we have to have access to.
What supports we have access to.
Sorry, we're going to do it again.
Labrador is focusing on well-being
Put it
to
up
become a
loud.
healthier province. But what is well-being and why does it matter? Well-being is defined as an overall positive quality of life where a person's needs are met in many important areas. Where and how we live and work and what supports we have access to, referred to as the social determinants of health, have a strong influence on our health and well-being. We experience far better health outcomes when we have access to safe housing, good food, and clean water, access to quality education from a young age, inclusive and stigma-free social connection, access to a justice system that protects us, access to good medical care and mental health supports, access to income that protects us from poverty. These are just some aspects that affect our health and well-being.
Thank you. Let's go on to the next slide now. So we prefer to use the term well-being than the social determinants of health. It's used in other countries, but in effect means it integrates not only the social determinants of health, but population health and health in all policies. And we perceive it that the combination of the social circumstances in which you live, together with your own personal responsibility, will influence healthy living. If you don't have enough money to eat properly, that's the social factor is influencing the way you eat. But if you've got lots of money and you eat irresponsibly, you have personal responsibility for your health. And then this whole process leads to more adverse health outcomes. Next slide. I'm not going to go into this, but this concept of social determinants and well-being is brought forward by Finland, New Zealand, Wales, and South Australia, who've placed the economy of well-being at the heart of policy and decision-making. That they've made it a priority and they've named it as being important to the way they are going to live, they're going to govern. And similarly, in some parts of Canada, we've got, next slide, please. We've got a spotlight from the federal government has developed a quality of life framework. Several provinces have taken major steps on the social determinants of health and well-being. They've embraced a health in all policies, and they've incorporated well-being considerations into their budgeting processes and policy frameworks. So this is not some sky and brainwave idea that's coming out of the health accord. This is coming from grassroots countries and our own provinces. Next slide, please. So let me get into where we should get to. So we're trying to develop a well-being framework about how we perceive measuring the things that are necessary. And we're talking about having 7 domains: health itself, society, the environment, justice and public safety, education, housing, employment and income, and providing metrics for each of those 7 domains that allow us to measure at baseline where we stand, and then how we can follow that in time as we're making interventions. We've compared these metrics across all the provinces, and here's the information we've obtained. Next slide, please. We have a dichotomy between our perception of how healthy we are and how healthy we actually are, right? So here we have strong feelings that we have good health. Functional health status is high. Our scores are, that's what we believe. However, our life expectancy, our death rates for cardiac disease, cancer, and stroke are the worst in the country. So we've got that dichotomy that we've got to deal with. And on the next slide, we have the worst metrics for low-income prevalence in children, at least we had until recently, and we have the highest levels of food insecurity in children. Next slide. For skills and opportunities, we rank poorly for children vulnerable in early development, these reds, high school not completed amongst adults, difficulty finding childcare, and youth not in education, employment, or training. That's called NEET. We've got the highest proportion of people in that age group in that category. So these numbers indicate where we need to give priority. The next slide. And our disease risk is driven by our lifestyles. The lowest rates of food and veg consumption, highest rates of drinking, highest rates of smoking, obesity, physical activity, lowest rates of physical activity. So clearly there's an indication that we have to consider how we have a healthier lifestyle. Next slide. And that's not difficult, I don't think. However, social cohesion and connections are the strongest in the country. There's a strong sense of connection and community, but it doesn't apply to everybody, as I've mentioned previously. You've got those excluded groups, Indigenous, seniors, LGBTQ, newcomers, and BIPOC. So we need to do something there. And I've just summarized the statistics of the big areas that we need to target. So here's a summary of that data. On the bottom left-hand corner in turquoise, we have the highest levels of strong feelings of good well-being in the country. So the fact we lead the country for quality of life. Now, that is good. That's an outcome that's necessary. We have high levels of social cohesion, safe and secure communities, confidence in our institutions. So that social cohesion, which you have in Lab West, says to me that we should be able to use that community strength to be able to get the changes that can lead to an improvement in the social terms of health and an improvement in healthy living so that we can go forward with better health outcomes. On the top corner, we had the highest rates of childhood poverty, the highest rates of, or the lowest rates of the highest rates of people who are not in education, training, or employment, high disease risk, and exclusion. So they imply to me that we need to invest in poverty, particularly childhood poverty, invest in skills and development and early childhood development. And we need to have an agenda for health promotion where the people are, in schools, in communities, in Lab West. That we need to invest in that piece, and then these family care teams can also deal with interventions for individuals. And finally, we need a strong inclusion lens and a capacity to ensure that people who are now currently excluded are actually included. Next slide. I sound like a preacher sometimes, so don't. So I was asked to update what actions have been taken on the health accord. Where do we stand? Give us a report card on the health card for the social terms of health. So the poverty reduction plan has been announced, and the fact that the NL child benefit has increased by 300% takes us towards the top end of provinces for childhood poverty. The prenatal early childhood nutrition supplement is extended from 1 year to 5 years. And then that capacity to be properly nourished when you're young is extended into school, where there is planned to have a breakfast and lunch program. And then in terms of targeting adult poverty, there are efforts to increase income, particularly by streamlining and improvement income support benefits and other pieces that I won't go into in detail, but also an effort to try and get more employment, particularly an employment stability program to bridge from income support and a non-EI eligible training program, support program to get people to develop skills and get into work. Next slide, please. So what about a seniors well-being plan? Now we know from extensive consultation with Seniors Plus and the Seniors Advocate and other represent 50 plus, that the key things that they're interested in is support for aging in place so that you don't have to go into an institution. So those things that would allow people to stay when they're frail and elderly in their own home or their own place are important to seniors. We also know that with the current cost of living, that income is an issue. And we know that for seniors in particular, access to healthcare, particularly things like joint replacements and cardiac surgery and hearing and et cetera, are important to them, and access to primary care. And then on top of that, they've reported to us that they need to feel the capacity to be able to look at their medical record electronically, to be able to make appointments electronically, to be able to access technology that will allow them to navigate the health and social system. So they're the big things that seniors are telling us. So policy development is being driven around those four big things. And I said, we'll hear about something about this year. Next slide. The Premier mentioned the Education Accord, which has 4 pillars: early learning and childhood development, education engagement and transformation, health and well-being in education environments, and post-secondary education and learning across the lifespan. So that is, that's not implemented. That's a plan to come up with a policy that allow us to act across the spectrum to improve education, which we believe to be really important because it is undoubtedly a social determinant of health. Next slide. The Premier mentioned the 5-point plan for housing. The interesting thing about housing is that we have the highest rate of acceptable housing in the country, but Canada's not that good. And then, of course, we have the issues around homelessness that are multifactorial that we need to resolve as well, which is a Canadian problem. So I'm not going to go into the details on these slides here. These have been published have been presented in the public arena. The next slide. Access to early learning and childcare. The Premier himself mentioned that the investments in the number of people who are in these new spaces. There's over 1,000 new spaces created in 2023. There's 18 pre-kindergarten sites. There's 63 child care providers in the process of opening not-for-profit childcare. So that has started. It's not perfect, right? But it is started when it wasn't there before, and it will have influences on access to early learning. And the next slide, child health. So that was a piece that we had a lot of belief that children in care, who are in alternate care, that they needed wraparound treatment for their multiple disabilities. They suffer from the trauma of being in care and the mental problems associated with it. There was a clinic created called Children and Youth in Alternate Care, called a Kayak Clinic, that was started in the Janeway. That's been expanded to the province, and the visits to Kayak have increased by 170% in 2023, from 582 to 1105. And then the other piece was to have a child health model that integrated education, social, and health departments. That's being developed with the idea that you're trying to integrate the capacity for a child with a problem to hit one access point for the health system and all the things the health system offers, plus an integration with social workers in CSSD and psychologists that are in schools. And so that policy will be announced this year, I'm optimistic. Next slide. And then the stuff around awareness and promotion. So there's a public health framework announced. We've had a well-being week to try and get people to be more aware of the social determinants of health, because if they're not aware, they won't vote in favor of it. And we'll be in the same place we've been for the last number of years. And there is an innovative program being developed by Cardiac Care and the community sector to try and develop events that can take place within communities to highlight the importance of the social determinants of health for each community. The next slide. So am I running out of time? I'm okay. So here's something again. On these remarks, I'd like you to try and think about them in your own community. So I'm strongly believe that the pathway to inclusion requires us to act in communities. That we have to have an approach that is nothing about us without us. That for Indigenous people, it's distinctions based. That we have a human rights approach and an intersectoral approach and a universal design, and that we speak in the language that's relevant to the people we're dealing with. And the areas that we need to intervene in are education and training, social determinants of health, access to equitable, inclusive health services, and well-being communities. So I'm going to come back to this about well-being communities. Can Lab West be a well-being community? And I'll reveal to you the elements that I think are important in that piece. And then obviously you have to evaluate what you're doing in an ethical manner. Next slide. So you've seen data that suggests what the priorities for the province should be if it believes that it should focus on well-being. So you need structures that allow that to happen. So their well-being communities are one piece, well-being networks, regional well-being networks, which in the health accord were called regional health and social networks, and involvement of the community sector. And I'll go into a little bit of detail about this so that you can get a feel for it. So the next slide. So the thought process behind these well-being networks is that within a region, that the principals are the top people responsible for the delivery of health, the delivery of education, the delivery of social care, the justice system, Indigenous people, community sector should get together at a table. And they should discuss the problems in their region that are the foremost problems and what they believe the potential solutions to be. And then they connect with the center government, who's responsible for developing policy to ensure that there is a bidirectional communication between central government, who will make policy, and these regional networks. And these regional networks would use the data that we have available to us, telling us what the social determinants of health are like within a particular region. So we've requested funding for 2 people for each network for 2 pilot projects, one in Western and one in Labrador. Next slide. And that these networks would have connection with not only with the municipalities and the community sector, but also with the NL Health Services and who have responsibility for health, for public health. So that's one structure that I can see helping with the social determinants of health. Then the next one, and they would have well-being teams, which would include more than just the 2 people that we'd hire, but also facilitators in the community sector, staff in public health, and social incubators envisaged by the social well-being plan. So it is feasible to think that you could have a well-being team that's going to solve a problem that's particularly important to your region, and it would make recommendation to the central government. And I think a good example of that was the homelessness issue that occurred in Happy Valley Goose Bay, and the proposal that occurred as a consequence of the people getting together. And the next slide. So what do I mean by well-being communities? So it has several elements developed from the World Health Organization. It should be age and dementia friendly. It should have digital literacy and supports to improve digital literacy. Transportation is a big component of a well-being community. Not only the transportation within your own society, like Clarendville have a bus driven by volunteers to bring frail elderly people in their homes to go to places like the doctor or the shop or the long-term care facility. So it would be impossible to put a transportation system like that in every community, but it is possible to think that healthy people, healthy elderly people in particular, could drive buses to support unhealthy elderly people, and they would benefit themselves when they become unhealthy. So it is a kind of a volunteer-driven piece, but it is a piece that would strengthen a community. An approach to healthy living, and by that I generally mean local food and activity. An approach to inclusion, an accessible built environment, supporting low-income seniors in need at home, particularly with nutritious food, a housing plan, and social programs for social and civic participation. And by that I mean, it's good, fine and dandy to have a hockey rink or a gym or etc. But if nobody's and the school gyms in particular, but if nobody's using them, they're a waste of space. Whereas if you can create the social and civic participation to create those programs, that would be good. The next slide. So where are we? This is the pillar of the bridge that I showed you earlier. So we've started on poverty reduction. We've done some good work on children in care. Policies have been delivered in these other arenas: inclusion, food insecurity, seniors' well-being, housing, etc. But they're not cemented into place to create a strong pillar to be able to support the social determinants effects. But it's only just started. right? So the idea would be on the next slide that, so well, before I get to the next slide, so where are we in the calls to action in the health accord at the moment? So policy development is in progress in 28 of the 59 calls to action. Actions have started in 24 and 7 have not, nothing has happened, but many of them are on dependent ongoing actions. So the next slide, this is what we perceive should happen, that we create this pillar of the social determinants of health to build a bridge to better health outcomes, associated with a pillar for better healthcare that's integrated across the multiple components, and bridge by pathways to change that allow these things to happen. And with that, which will take a long time, won't happen in 1 year, won't happen in 2 years, it'll take more than that. That bridge can be created to get better health outcomes. So I think I'll stop there. You've had enough, I'd say.